I'm Dr. Seth Hosmer, and I'm a chiropractor here in Portland, Oregon. I graduated from the University of Western States in 2007 and opened my own practice right away. My first few years in practice were well-intentioned but not effective. What was lacking for me at that time was an understanding of how it all fits together in terms of the body and how to actually help people. Oddly enough, I didn't feel like I could really adjust very well out of chiropractic school, and so I worked with chiropractors that have been in the business for over 30 years, and they helped me understand the rationale and how to make an effective adjustment that really helps patients. Being an athlete myself, I realized how important it is to treat the soft tissues. And so finding problems with muscles, with ligaments, with nerve entrapments, and so on became part of what I did as a practice. So what we find for most of the students that come to do an internship with us, they are, like I was, motivated and educated, but they don't really know how to help people. And so the very first time you get someone on the table that has an acute low back and they can't move, it's panic time. And so being able to guide students through that process and provide an effective mentorship program helps them understand how to work with a variety of patients with all types of conditions and make sure that they feel confident and effective in helping those patients. One of the things that's always been important for us as chiropractors is to be able to have people that we are bouncing ideas off and running cases by. If you have questions about a patient case and what's going on with the patient, if you don't have anybody to talk to, you're gonna just do the best you can on your own. But if you have people that are more experienced around you or have other ideas around you, it's gonna be much easier to continue to improve your skills so that you can increase your clinical effectiveness. I opened my own practice because I felt like I had a strong opinion about how to help people. And though I didn't really know what I was doing, the principles were there in terms of feeling a deep desire to really help patients and solve problems. And so what that's developed into for us is an effective way to find and fix joint problems, find and fix soft tissue problems, and teach people to do the same thing on their own at home so they can get quick results for their case. The first couple months of an internship depend on the needs of the student. And so some people will have a strong background in adjusting or soft tissue or rehab or something like that, and we won't have to spend as much time on some of those principles. But we first need to get a good idea of what their understanding of patient care looks like and how competent they feel with various case types. And we basically fill the gaps that we find. So if someone has never treated an acute low back or a disc herniation, we're going to make sure they know how to evaluate for and treat those conditions so they can help those patients. We do spend a fair amount of time making sure that the students understand the philosophy of what they're doing and why. We don't want them to be shooting in the dark. We want them to know why they're actually treating the patient the way they are and how do you treat this patient differently than that one. We find that most of the students that are interested in practicing with us actually have the same sort of approach to patient care that we do. They're in it because they want to help people. They might not have the skills that they need or the knowledge they need, but the desire is there to help people, and that's the most important thing for us, for them to fit into our culture. We want people that are really interested in helping patients and doing whatever it takes to figure out what the patient needs and moving their case forward. It works best for us when we're looking for a new chiropractor to hire someone that we've already trained through the CBCE program, because they already know our philosophy, they know our treatment techniques, and they have confidence in their ability to help patients once they're done with the program, and they're generally ready to hire day one out of school. If someone's not happy, they're not going to stick around. And so we spend a lot of time investing in the skills and knowledge of our chiropractors, and so we have to pay a competitive salary with full benefits to make sure they're happy, so they stick around for the long term so they can build good relationships with patients and get the results that we're all looking for. If this sounds like a good fit for you, please contact me through the website and let us know that you're interested in participating in our program.